What if I told you there's something happening inside your mouth right now, or more likely every single night while you sleep, that could be slowly destroying your teeth, wrecking your jaw, and even affecting your hearing? And the scariest part? You'd have absolutely no idea it's going on. So let me tell you about something I see all the time in my patients: bruxism. That's just the medical term for grinding, gnashing, or clenching your teeth. And here's what makes it so tricky. Most people do it completely unconsciously. It can happen while you're wide awake, but it's especially common during sleep, when you have zero control over it. The warning signs are pretty classic: worn down, flattened teeth, increased sensitivity, a sore jaw in the morning, tender facial muscles, and those dull, nagging headaches that just don't seem to have an obvious cause. Now, here's a number that always stops people in their tracks. According to a major 2024 meta-analysis, sleep bruxism affects roughly 21% of the global adult population. And in North America specifically, that figure climbs to about 31%. We're talking tens of millions of people. And chronic grinding doesn't just wear your teeth down. It can lead to fractures, serious jaw problems, and even changes in how your face looks over time. But the part that really gets me? You could be grinding your teeth every single night and have no clue. The jaw muscles involved in bruxism can generate tremendous force, sometimes exceeding 250 pounds of pressure per square inch. To put that in perspective, that's roughly 10 times the force you use just to chew your food normally. That kind of pressure doesn't just cause minor wear, it can crack and fracture teeth, and eventually grind them down to the point where you're looking at root canals, implants, or dentures. And it's not only your teeth that suffer. If you're a chronic grinder, you could actually be clenching and grinding for significant stretches of your sleep cycle every single night. That's more than enough to leave you waking up with a pounding headache and a jaw that aches before you've even had your coffee. And if this keeps up night after night, the damage doesn't stay cosmetic, it can become permanent. Research shows that TMD, temporomandibular disorder, is highly prevalent, affecting approximately 31% of adults. And bruxism is one of the leading risk factors that pushes people into that category. TMD affects how your temporomandibular joints function. Those are the joints on either side of your jaw that connect it to your skull and allow you to eat, talk, and chew. When you're constantly overworking them, they break down. And on top of the pain, there's another consequence that surprises a lot of people. When those jaw muscles are chronically overloaded, they actually grow. They become enlarged and tender, and that can make your face look noticeably more square and masculine. It changes your appearance in a way you never signed up for. Then there's the hearing connection, which honestly doesn't get enough attention. A large-scale study of over 3,600 dental patients found bruxism in 65.5% of those who also had tinnitus, that persistent ringing in the ears that, over time, can contribute to hearing loss. The anatomical link makes sense when you think about how close the jaw muscles are to the structures of the inner ear. And here's the thing that really drives this home for me as a doctor. Unless someone sleeping next to you happens to hear the grinding, you might not know anything is wrong until your dentist spots the damage at your next checkup. By then, the wear has already happened. Estimates suggest bruxism in some form affects up to 30% of the population, and when you factor in milder or occasional clenching, that number climbs even higher. Most people just don't know they're doing it. Now, there's no magic cure for bruxism. I want to be upfront about that. But there are real solutions that help. A custom night guard won't stop your brain from sending those grinding signals, but it will act as a buffer and protect your teeth from taking the full impact. And since stress and anxiety are among the biggest triggers, many of us in the medical community also recommend things like therapy, mindfulness, and meditation as part of the treatment approach. So honestly, sometimes the best prescription for teeth grinding might just be learning how to genuinely unwind. Which, when you think about it, doesn't sound like a bad deal at all.